Energy osteopathy, where stillness becomes healing.
What if healing didn't come from fixing, but from listening? What if the deepest changes in a patient's body didn't come through force, but through presence? This is the world of energy osteopathy, where intention becomes medicine, and touch becomes a conversation. You might ask, is this still osteopathy? The answer, not in the conventional sense, but in its deepest spirit? Absolutely.
Osteopathy is more than bones and joints. It's a philosophy. It's a way of seeing, a practice of presence. And sometimes the body speaks in rhythms so quiet. So we have to stop doing sometime and simply start being. Dr. William Sutherland spoke of the tide, a cranial rhythm moving 10 to 14 cycles per minute. Dr. Baker's described a deeper wave, a long tide unfolding over 90 seconds, and Dr. Fulford, he don't even care about the rhythm. He spoke about energy, breath of life, something scared, something you feel more than explain. In this space, the hands don't manipulate, they just listen. Here we are not fixing, we are trying to witnessing. And in the witnessing, something begin to shift. So from cranial rhythm to chakra balance, from visceral release to energetic flow, there are layers of this work. You may call it prana, qigong, tide, or resonance. There are many names. The level doesn't matter. Sometimes patient may say that I still feel your hands even when you are not touching me. So it's not imagination, it's that's connection. It's sounds a little bit strange, but when you do energy osteopathy, the real healing doesn't happen because of what we do. It happens because of who you are when you do it. Presence, clear and grounded. So you become the fulcrum, you become the still point and the tuning fork that invites the patient's system back into resonance. The body is not just a structure, it's a story. And sometimes the story is stored in silence, in breath, in sentence that has no words. So, what we call energy cysts or emotional imprints are not metaphors, they are felt realities. So, the abdominal twitches, the throat tightness, our memory surfaces. This is not performance, it's a permission. The unwinding, the chakras work, the CV4 or Becker's hold or the Victoring. These are not techniques, these are doorways. The real technique is stillness. We are not here to fix the body. We are here to remind it of what it already knows. Like the healing happens not when we do more, but when we become less. Less ego, less distraction, and more presence. In this quiet situation, something awakens. So the tide moves and the body remember how to heal. So how do we access it? So it's not through force, it's not through will, but through just being present, attentive, and receptive. When the practitioner becoming still enough, the system begins to speak. It may not use words, it may not follow logic, but it speaks through rhythm, through resistance, and through resonance. Potency is not power over the patient, and the power with an individual or an invitation to recognize, to self correct. So that's why presence is everything. We are not here to fix, we are here to facilitate. And facilitation begins when the patient feels safe, safe to let go, and it's start healing automatically. So this is how energy start working. We are not healing, we are just try to facilitate. So sometimes patient ask, are energy field, chakras or magnetism really part of osteopathy? The honest answer is not officially, but osteopathy is a philosophy, and in that philosophy there is room. Room for stillness, room for subtlety, room for sensing something that is not quite physically, yet not imagined either. So many practitioners begins to feel something in the quiet involved around the body, a zone 8 to 10 centimeter from the skin, a field of communication, a sense of pull or warmth or resistance. So you are no longer touching the fascia, you are touching the story. Sometimes that story is held in what we call energy cyst, an unresolved trauma sealed sealed off from the body's regulatory system. It could be a fall, it could be a surgery, it could be a loss, something that mind could not process. So the body just held it inside instead of exploring that thing or not holding that thing. So these are not just blocks in tissues, they are paused in the flow of life, and they begins to release not with force but with the presence. The solar plexus often becoming a gateway. It holds the breath, it holds identity, it holds the tension between doing and being. When a patient's breath deeper, when their abdomen soften, that is not just relaxation, that is a recognition. You might see an unwinding, a slow spiraling release. The arm moves, the leg pulses, the cranium shifts, but that is not manipulation. It's the body's finding its way back to coherence. We don't guide it, we just follow. So often the most important works happens when we stop doing. We become still, and in that stillness the body speaks, and the spirit softens, the nervous system says, I'm ready. So there are moments in practice where the room becomes scared. You hear nothing, you feel everything, and then the patient whispers, I feel something move, something like that. Sometimes patient says like, I remembered something I didn't even know I didn't forgot. I thought I would forgotten. So that is the work. So what is energy osteopathy? It's not a trick. It's not a show. It's the art of listening, of being still enough so if someone else to feel safe enough to heal. So in the end, healing does not come from doing more, it comes from doing less. So less force, less thinking, more presence. So in energy osteopathy, it's where stillness heals. So we should focus more on the stillness, not the doing things. So let's go deeper now. What is energy osteopathy? Is it a spiritual work or it's a science? Is it real? It's all of this and none of them, because energy osteopathy begins where definition ends. It begins with presence. Not presence as in being in the room, but presence as in being completely available. With your thoughts quieted, your breath matches, and your heart attuned to theirs. We have been taught to look for bones, joint, fascia, but deeper than fascia lies a field, an electromagnetic field, yes, but also a perceptual field that ancient healers called the aura, what we now feel as vibration or expansion or resistance. You cannot discard this as an anatomical lab, but you can only feel it with an open nervous system, a receptive heart, and trained that goes beyond the mechanical. In energy osteopathy, we didn't chase the rhythm, we wait for it. We don't go for this and that, we just wait for it to feel the right rhythm. We attune the long tide that scared the rhythm, 45 seconds in, 45 seconds out. So this rhythm cannot be forced. It appears only when the system feels seen, acknowledged, held without expectation, and then it's happened. It recognizes everything. Energy osteopathy is also about maps, not anatomical maps, but energetic one. The chakras are not just spiritual metaphor, but deeply intelligent center that correlate with nervous plexus, hormonal glands, emotional patterns, the solar plexus, the heart, the throat. These are not just poetic centers, they are places where trauma heals, where stories lives, and where transformation begins. So we often call this walk subtle, but subtle doesn't mean small. Subtle means profound. Subtle means powerful enough to shift a system without touching it. So that's the paradox of energy osteopathy. The less you do, the more will happens, because you are not leading, you are not judging, you are just joining, you are not correcting, you are just reflecting. So this field doesn't want you to be dominated; it wants to be acknowledged. There comes a point in treatment when your nervous system merges with theirs, their breaths slower together, your heart rhythm synchronize, you feel that they feel sometime before they do. So that's not magic, that's the coherence. In coherence the body begins to let go. It might be lets go of the pain, of or protection, of the pattern that no longer serves. And when this sense ends, they may not have words. They may say, I feel lighter. It's like something left my body. I don't know what you did, but something shifted. So these are not placebo effects. They are physiological reflection of the field being to restored to harmony. And this is the unseen work of osteopathy. So energy is not something we add to the session. It is something we uncover by getting out of the way. So energy does not start when we touch. It was moving from the moment of conception. Our job is not to ignite it, but to recognize it, to feel it, to harmonize with it. This is not mysticism, it's an ancient science rediversified in modern terms. It is the body's remembering its own blueprint. So, healing is not about doing more, it's about becoming less thought, less force, less noise. What remains is presence, and that's where healing begins. What healed was not the technique, it was the connection. In medicine, we often forgot the value of being with someone, not directing, not instructing, just being. A child seeks comfort not in solutions but in presence. So does the patient. The greatest illusion in healing is that it must be complex, but often basic things done well. Diaphragm release, cranial vault hold, gentle sacral balancing open the energetic pathways more powerful than the most elaborated tricks. So healing is not about doing more, it's about becoming less thought, less force, less noise. What remains is the presence. That's where healing begins.